Hi, I'm Shane Bales, Doc Hockey for Pro Action Sports Injury Clinic. I've been talking to a lot of groups lately about joint health, and the way we get joint health here at Pro Action is basically through CARS, which was exercise kind of routine, a mobility routine, really strengthening and flexibility by Dr. Andreo Spina. So CARS stands for Controlled Articular Rotations. Okay, so basically the controlled part is putting tension into the body and the joints. All right, so there's bracing of the whole body. And when we do that, especially as a morning routine, we're doing it about 30% of bracing throughout the body. The A stands for articular, so we're doing all joints, okay? So we're looking at neck, shoulder, shoulder blade, wrist, elbow, spine, so upper, middle, and lower spine. We do hips, we do knees, ankles, and even toes. All right, so that's where the A kind of comes from. Rotations, basically what we're looking for is full range of motion. So we want to put the joint through tension in a full range of motion so that the muscles remember how to control that range of motion, and that's why the tension is so important. All right, now we want to have big circles when we do this. The rotation part is the big circles that we're doing, okay, and through there. So we want to put tension through that joint with the big circles at about 10%. So if we're doing 30% of body bracing, then we do 10% of joint bracing, and this can be changed throughout the day. So as doing a morning routine, as you can see here, every morning we can do it at about the 10% of joint tension and 30% of body bracing, and then we can progress throughout the day to increase those. So maybe I'm doing a 60-40 or an 80-60, so that we're putting more tension in the joint, which makes it stronger, more mobile, and more healthy. All right, so I'll demonstrate one of the ones, the neck exercise that we do, okay? So when we're here, we might want to be standing up nice and tall, feet about shoulder width apart or so. All right, we have our hands against our body, so I'm doing that bracing with the hands against the body, which braces through the pecs and the core. Our feet are almost being pulled together, so we're bringing that in, so that brings tension into the legs. If I keep the legs straight, I contract the quads, keeping that, as well as contracting the glutes, and we're doing that, we're getting the whole lower body kind of bracing in through there. So I'm holding it, and then I'm breathing through your diaphragm. So when you're breathing through your diaphragm, just like when you're doing weights, it's kind of a controlled breathing, so it's kind of laborious when we're doing that. So you're actually able to produce more strength that way. Same reason we're doing the bracing with the bodies, to put more strength into the neck, because everything that we brace goes from bone to muscle to tendon to ligament to capsule and into the joint itself. All right, so as I do my bracing here, if I'm starting with the neck, I bring the neck all the way down, and this is the only joint I'm moving, so I'm trying to keep that joint only in the neck moving and not anything else, so I don't bend the whole spine, it's just the neck all the way down. I come all the way to the side, so this is part of my big circle. I come all the way back, right, in kind of that circular pattern, all the way. Good, all the way to the side, keeping that bracing nice and tight with my hands against my side. Sometimes people use fists to get a little bit more bracing. All the way forward to that side and all the way around. Nice and controlled. I can feel the tension in through the neck when I'm doing it, so it's not just big neck circles, it's controlled when I'm doing that. If I find a spot that actually is painful, so if I come back here and I close this angle down, I get a pain through there, I'm actually going to avoid that spot. So I might come here and I might return back around to the other way with the circle, or I might go to that side, I feel that little bit of pain, I'm going to come around it, and then I'm going to continue again through the back part. So you always want to make sure we're avoiding pain, because we don't want to aggravate an inflammation or a pinching in that joint as well. All right, so that's how we do and keep our joint health. The reason we're doing this joint health, so you don't have to come see me or other therapists because you end up spraining something. You'll be able to control those end ranges from neck to shoulder to elbow to wrist, all those things without becoming injured. So hope that helped you understanding what CARS is, and hopefully you can get a new morning routine. So give us a call if we can help you with that. I'm Shane Bales, Doc Hockey for Pro Action Sports Injury Clinic. Thank you.